Hello mga ka-CSA, I'm back! I'm Mariah Santos, celebrity makeup artist. Nandito ulit ako kay Dr. Contessa to make follow-ups after 8 months ng aking treatment before for nose and face contouring. Ngayon, I'm back with Doctora for my follow-up. And it's been a while na hindi ako nakakapunta dito dahil sobrang busy ko. Na-overindulge ako sa lahat ng mga pagkain and travel ko abroad for the makeup and my work as well. So, sabi ni Doc, kailan ka babalik? Sabi ko, Doc, okay pa naman yung mukha ko. Pero sabi niya, siya mismo nag-i-insist na, balik ka dito. Pero, it's just a follow-up for my face and nose contouring. So, see you guys in a while. Makikita natin ang before and after ko.
Welcome to the CSA Certified Skin Authority. I'm your host, Dr. Contessa, your certified aesthetic physician and your skin health practitioner here at the CSA Medical Aesthetics Center. And mga ka-CSA, we're so privileged to have with us again ang nagbabalik, Miss Mariah Kamaya Santos.
Hi! I'm back, guys.
Welcome, Mariah.
Hi, Doc. I miss you.
Yes, I miss you too. Because we have been following up with her, yung mga previous treatments niya, kailangan naman talaga may maintenance treatment, right?
Pero actually, siya ang nagpo-push. Ako, okay lang naman ako. Sabi ko, Doc, wala naman nagbago. Okay pa rin naman. Except na sabi ko, medyo yung face ko lumalaki. Dahil sobrang indulge ako sa pagkain.
Food.
Dahil nagtutour ako ng sa mga weddings.
Yes.
Abroad, syempre hindi ko mapigilan.
Right.
Pagkain. Pero okay naman siya, Doc. Pero, of course, Doc, ano man ang follow.
Yes, the thing kasi with us naman, whenever we do our mga patients and clients namin, we always check on you. We wanted to see how well was our procedure, kung ano yung naging effect.
Gusto ko pa sa kanila.
Yes.
Doc, even see my picture in Facebook.
Right.
Oh, I saw your picture. And then, dapat gawin na natin to.
Yes.
Sabi niya, so
may
nabigla
kasama
ako.
na pong assessment. Yun, so pag may nakikita na ako ng kailangan, so nire-remind ko na siya. And thank you so much. You're here with us again. Para, of course, i-share na rin natin sa ating mga televiewers. Ano ba yung pwedeng maintenance treatment para tuloy-tuloy na yung shape ng face natin ganito. Eh, syempre naman, constant naman yung pagbabago sa mukha dahil sabi nga, si Tita Pinky nga, minention niya, everyday we age.
Oo, actually.
Sabi nga niya, by the minute.
Actually, even sa the food we intake,
Correct.
It changes. Oo. Inner, sabi nga nung isang friend ko din na parang sa health din.
Correct.
Sabi niya, kung gusto mong gumanda outside, kailangan, you should be healthy inside. Para mag-reflect siya,
may inner joy din, right?
Hindi lang puro kay Doc Contessa, kailangan cooperate din kayo.
Correct.
Baka sabihin nyo, uy, ba't hindi effect? No, kailangan.
Diet mo, may exercise ka, hindi ka masyadong nagpapastress, happy ka lang, may inner joy. And here at CSA, it's always our advocacy na mga non-surgical tayo. We want procedures or treatments na natural and at the same time nare-retain yung iyong identity. Hindi ma-alter or ma-transform yung ating face, yung look, yung anatomy ng mukha natin. Kasi marami pa rin yung gusto nila na gusto ko, Doc, simple lang, or natural pa rin, or parang fresh lang. Yun lang.
Enhance lang ng konti. Kasi ako, I've been parang several assessment na, uy, paggawa mo ng ilong mo.
Maraming nag-aalok.
Oo, dami nag-aalok sa akin na parang, dali, paggawa mo na, sabi niya gano'n. So, pa-surgery na ako. Kaya lang, hindi siya pwede, Doc, sa schedule ko.
Sa schedule niya?
Yung downtime
mahaba
kasi,
yung recovery period.
And then, I also a believer of feng shui kasi. Nung nagpa-feng shui ako, sabi, my nose daw is swerte because it's in, nasa middle part.
Yes.
So, no cutting should
No
be done.
cuts.
So, ako naman, I don't know, but basta ako gusto ko lang, I'm a believer kasi. So, doon na lang ako, di ba?
Naalokan ka na rin pala ng surgery. Same thing here.
Oo.
Naalokan din ako ng surgical rhinoplasty. Yung mga colleagues ko from Korea, and these are top caliber surgeons. Pero I also told them, I still would want non-surgical pa rin.
I love your Korea,
Ayun. And thanks to them for bringing to us mga Korean thread lifting, non-surgical nose lifting. Yung last time namin.
It's known Koreans are very known with that.
Right. Sila kasi yung nag-innovate in making use of mga protein threads for face enhancement.
Tsaka docs, huwag kayong matatakot, like to the audience, huwag kayong matatakot with the injection kasi it's not painful. Ako, sobrang takot ako. Hindi ako nagpapag-gluta drip or something.
Yes.
Pero with doc naman, the procedure is okay naman. Parang meron ka namang anesthesia eh.
Right.
So parang wala talaga na.
As much as possible, we want to minimize, reduce, or get rid of the pain sensation or any discomfort. Yan. Kung meron man tayong mararamdaman, mga tolerable po. And we do our best na magkaroon tayo ng pang-numb or ma-anesthesize yung skin part, yung face part. Yan. Meron po tayong pang-anesthesia dyan.
Kaya matatakot.
Right. Yes.
Tsaka siya lang yung trusted when it comes to my
Okay, thanks Mariah for trusting us.
Yan na nga ang tawag eh. Tawag na nga sa kanya ngayon.
Ano na po?
Non-surgical queen, nose queen.
Non-surgical. Yan po ang aming advocacy. Of course, with Mariah, what we're gonna do right now is the nose enhancement, ang ating Asian nose lifting, non-surgical. Yes. And we'll maintain na rin yung face contouring niya, yung kanyang face slimming, making use of our Ulthera, and also the injection of Botox. So, ating ipakita sa ating mga kasyesi sa pagbabalik ng Certified Skin Authority. We're back mga kasyesi, so we will now do the so-called Asian nose lifting for Mariah. Okay? So we have to start with the injection of the lidocaine para po numb yung sa tip ng nose. Dito po, okay. Like a 0.1 to 0.2 ml ng ating lidocaine with epinephrine. Okay. So kailangan po, this is very numb. This is our entry point for our nose fillers and nose PDO threads. How was that, Mariah?
It's not painful, though.
Yes. So, natotolerate naman natin yung entry ng ating lidocaine. So, now we make the so-called entry point. So, actually, I follow yung sa vermilion border ng ating upper lip, the center one, and then make an opening here. So, for my nose filler, I still make use of the Restylane Perlane. So, this is natural filler, Mariah.
Maganda yung brand na yan.
Yes. We had done this on Mariah previously. We had an episode ng nose enhancement using combination Restylane Dermal Filler and the Hyco PDO threads. So we did that like about, you still remember, Mariah?
8 months ago.
Right.
Actually, meron pa siya eh.
Yeah, meron pa. But we want to give further enhancement. And because Mariah is always busy, basta may pagkakataon, we do the procedure. Actually, there was a study they did on the Hyco PDO threads or the PDO nose threads. Na pag dinagdagan mo siya, even as early as 3 months, yung layer nung formation ng mga tissues, pag dinagdagan mo ng threads, nagli-layer up pa. So, nagdadagdag pa. So, nagkakaroon ka pa ng natural tissue build-up. Okay. So, ito para ma-enhance, ma-boost natin yung nose lifting. So, this is the filler. Okay. So, I have a single point of entry here. So, I make use of a cannula. Okay, pasok lang po. So, I remember, noong last procedure natin, Mariah, dito sa middle part ng nose mo, di ba? Meron tayong tinatawag na rhinion. Yun yung parang dorsal hump. So, meron kang prominence doon, parang bony prominence. So, maganda talaga na, syempre, you've been my client and I already know yung anatomy ng nose mo. Okay, so you know that something is going inside. So again, this is just dermal filler. So ayan na po yung aking cannula is in the radix or the root of the nose. So alaga din ng skin ni Mariah. Ang ating skincare, right?
Yes.
So nakakapag oxygen infusion, oxygeneo.
Yes.
Yeah. So it's very important that we take good care of our skin. Actually, I can feel some yung mga resistance sa loob kasi parang nagkaroon na rin ng mga fiber bridge formation inside the nose.
Oo, no?
So, kaya pagpasok ko, nafe-feel ko na yung mga parang laman sa loob. Mga fibers. So, I'll be pushing this filler dito sa root of the nose or the radix. So, marami pa rin umaabang ng ating non-surgical nose lifting. Especially with Mariah also, maraming followers. So, they wanted to see yung enhancement, improvement. Tsaka ang laki ng impact kapag kailong.
Oo, center.
Yes. It's the centrofacial. So, ang improvement is really a big percentage. And nakaka-boost daw ng confidence. Iba kasi ito daw ang insecurity nila. So when you do the nose, when you improve the nose, maganda yung result. Then maganda rin yung effect sa ating life every day.
Confidence.
Yes. Boosted confidence, self-esteem. Tsaka
Iba.
sabi, yes. Yan. Yung iba naman, if they wanna look for a partner, relationships, or maganda rin sa society, pagka very beautiful, iba ang impact. Yan. So I'm just injecting the dermal filler into the dorsum of the nose. Okay. Actually, the dermal filler has a Restylane lidocaine. Meron na rin siyang kasamang pampamanhid. So, while inside, lalo pang nagmamanhid. So, I can feel already yung firmness na sa loob. Kumbaga, yung space na nasa loob, it has been filled in with this dermal filler. Okay. So, may na-feel ka ba na parang nahahatak na or nahihila na? Now, the same point of entry, I can do a tip projection. Kasi we also want to have a narrowed nose here, or mas maliit ang ating sides of the nose. We can correct that by so-called tip projection or a tip columella show. So, ipakita natin ang columella ni Mariah. So, I'll use the same point of entry. So this one I have to inject up to the so-called nasal spine. So you'll just feel something sa may gum area that's normal, or parang sa ibabaw ng ngipin also. You can feel that. There's something na parang may nagpupog that's normal. Yeah, but it's okay. It's tolerable lang. Parang sensation din na nagpapadental. And then I'll be pushing the filler. Kailangan kong lamnan yung dito sa nasal spine. Ang Filipino and Asians kasi, we have a lowered nasal spine. Unlike ng mga Caucasians, elevated ang nasal spine nila, kaya makita mo pointy ang kanilang tip. So the technique here is to fill in.
Feel ko na doon.
Yeah, nafe-feel mo lang na something is going inside, but this will have a very good impact sa improvement ng nose profile mo. Okay. So actually, I can notice na nag-elevate. So, it's normal lang na na-feel mo yung kanina sa may nasal spine. So, we can...
For me, nakatusok.
Yes, it's normal. Actually, wala na yung cannula. And then that will merge or bind with your tissues inside. So, this
yun, the tissues.
Yes, this is already the HICO thread. So, we're doing a combination procedure for... Okay. So, ayan, yung sinasabi ko kanina na may yung rhinion. That's called the rhinion. So, medyo nafe-feel mo siya. So, I'll be overpassing that. another PDO again. Sponge.
Birthday kasi ako, Doc, eh. Kailangan maganda ako.
Yes, advance happy birthday. Okay, so mga ka-CSA, we have done already dermal filler and some few threads. We'll continue when CSA returns. Okay, mga ka-CSA, so we will continue. We'll be adding PDO threads. Kanina ang ating mga dermal fillers. Right now, we'll be using a thread. It's COG, and it's shorter than the other one a while ago. We wanted only up to the middle part kasi I wanted to avoid yung rhinion, yung bony prominence, or the sulcal-dorsal hump. So, I'll use the same point of entry. So, I'll be injecting this PDO nose thread or PDO COG thread. This is 40 millimeter, this one. It's only up to the middle part. Okay. So, inhale, exhale, Mariah. So, it's quite a bit, what do you call this? There's a resistance. So, nafe-feel ko talaga meron pa yung dati.
Oo ka. Na-absorb siya, no?
Yeah, the threads are absorbable. These are biocompatible, and these are absorbable threads. But while they're being absorbed, nagkakaroon ng tissue formation.
Kaya parang ano siya, parang sobrang hiyang ko. Parang
naglaman nga sa loob.
Oo, parang nag-ano siya.
Nag-form.
It's safe?
Yes, actually these are well studied already. So, since the threads are absorbed naman, so nawawala rin naman sa system. But then, what is longer lasting is the tissue formation. Okay? I have some patients kasi, like we did a procedure. For example, we did it right now. And then after a month, they message me, bakit daw parang nawala na siya or bumaba na siya. Hindi katulad nung immediately after. But then I tell them or explain to them na yung mga threads and fillers, they are inside your nose tissues. You just have to wait for the PDO threads to induce a so-called tissue buildup or collagen formation or protein synthesis. So, it's a process po, and it's a gradual process. So, we're done with the bridge enhancement. So, we have used dermal filler and PDO threads. Okay, so we'll do the tip projection again. A while ago, I injected some dermal filler up to the nasal spine. So, I will make use of this 40 millimeter PDO thread. It's a COG PDO thread to further lift the tip. So, pwede nating iangat para rin ma-reduce yung sides or ulnars of the nose. Okay, so Mariah, I'll be holding the columella, yung gitna. So, you can open your mouth, breathe through your mouth. Okay, very good. So, I'll be using the same point of entry. Okay, I'll need the entry point again. So, this kind of treatment, again, this is non-surgical. So, we have to go to trained physicians to do this. Gagaya ni Mariah, she's been returning to us. Thank you for trusting us, Mariah. Okay. So, some of my patients talaga, when they have a treatment like this, may bleeding sa entry point, but that bleeding will stop naman po. And then, this is my entry point again. Okay. Inserting up to the nasal spine again. Just inhale, exhale. Sabi nga nila, sometimes tiis ganda talaga. So, I'll pinch yung columella sa gitna and enter up to the nasal spine. Inhale, exhale lang po. I can really feel some resistance already. So, nagkakaroon talaga ng tissue buildup sa loob. So, that's one. I need another one, last one. And then we can proceed with the so-called injection of Botox into the ulnar area. So, we did already our Asian nose lifting. So sa ating nasal bridge, we use the dermal filler and PDO threads. And for the tip projection, dermal filler plus PDO threads 40mm. And we also did alar reduction, making use of our Botox. So we injected a while ago, about here, I injected like 6 units. And on the other side, 6 units of the Botox. And part of our regimen with Mariah is the face contouring, face slimming. So we need now a maintenance for the reduction of the masseter also. Kasi itong chewing muscle na to, laging nagbo-bulge, it is hypertrophied. So it's causing yung parang bigger part dito sa lower face ni Mariah. So this is the injection of the Botox again. Okay, so we'll ask Mariah to clench. Okay, make a clench, and then I'll just inject into the muscle. Okay, so dito sa ating right side ng face.
Okay na, relax.
Yes, relax na. Okay. And then another one, bite, and then inject. So most of the time kasi, yung muscle na to lumalaki when we chew too much, like yung panguya-nguya ng mga, yung iba kasi yung matitigas na mga karne, steak, yan, or yung iba, chewing gum, or ano pa bang inunguya natin, nuts, yan.
Sobrang takaw lately.
Yan, so
nag-tour ako so talagang...
Right, so nag-tour si Miss Mariah. Siyempre, when you go abroad, you taste all the kinds of food.
Bawal ang
Recently,
diet.
Japan, right?
Yeah.
Sarap pa naman ng food. Japanese food.
Japanese.
Yes. And then we'll do sa other side, same technique pa rin po. So kanina meron akong nilagay na surface markings. I made a drawing from the tragus to the corner of the mouth. And then I felt for the belly of the masseter muscle. I made a line here. And then inject ko lang, clench. Okay, you can already feel the muscle. And then intramuscular injection only. We push. Okay. Then exhale. Then again, bite. And intramuscular lang, then we inject our Botox. So again, ang action ng ating Botox is to relax our masseter muscle para po medyo mag-slim yung dito.
It's very effective actually.
Yes.
I've been using that for almost 4 years now.
4 years, correct.
4 years. Hindi na bumalik yung fatty face ko.
Right.
Yung face ko before was so big talaga. Pero ngayon, pag medyo na-feel ko na medyo lumalaki, na-maintain siya.
Pagka-slim. And plus, of course, we did Ulthera.
Ulthera,
Yes. Our high-intensity focus ultrasound for the face slimming as well. Yeah. So, magandang partner ang Botox tsaka Ulthera para magpaliit ng ating mukha. O yan, so ating ipakita ang result
I'm so excited!
Yes, non-surgical Asian nose lifting for Miss Mariah. So, our mirror, please. Ayan. Ma'am.
Ay, ako ba ito, Doc?
Right.
So ganda! Yeah. Parang akong foreigner.
Right. So, na-lift.
Doc, parang surgical.
Yeah.
Parang surgical effect.
Yes, parang namimik natin ang surgical rhinoplasty. Para kang nag-vortex.
Doc, parang this is times 2 better, no?
Yes.
From the first
natin. The previous treatment we did. Right. Because we did also tip projection. The last time,
it's mas mataas.
Yes, higher. Yeah.
Siguro dahil dun sa first, inabsorb na niya.
Right.
And then,
so right now, we just add on para po ma-boost natin yung ating nose enhancement.
Pati yung eyes, no?
Right. Pati mata, gumanda po lalo.
Pati yung eyes, parang naging
And what did you notice doon sa side ng ilong? Ano po yung napansin?
Ay, nawala yung bulge ko here. Kasi meron akong bulge dati here.
Right.
And then ngayon nawala na, parang tumaas. Tapos lumiit yung yung dito ko, Doc.
Yes.
Yung
so the alars, the alars po na reduce. Exactly. Yung technique that we did, yung tayo yung nag-filler doon sa kanyang nasal spine, yung pinakaloob po, nag-fill in tayo, in-elevate natin. So when we elevated doon sa columella area, so parang nahila yung sa alars. So we were able to cause a reduction on the alar areas. magandang impact po pag we do a tip projection, we make it like a pointy tip. Kasi Asian nose, well-known tayo, di ba? Rounded ang tip, tapos wide ang alars, flat ang nasal spine, aside from having a shorter nose or a flat bridge nose. So what we did was to enhance those areas. Itinarget lang po natin yung mga areas na yon. So this is different compared dun sa first treatment or first procedure we did with Mariah, yung 8 months ago. So as early, actually, I tell some of my patients as early as 3 months, you can already add threads or PDO threads. Para po yung layer, the first layer where we did our HycoPDO threads na nag-cause na po ng mga collagen and tissue formation. So you're adding again, so nagsa-second layer ka, nagbi-build up ka lang po. For some of my patients na those whom I have done before, yung iba kasi they message me after a month, Doktora, parang bumaba na, nag-subside na. Actually, nag-absorb na po yung mga dermal fillers, plus some of the threads are already being absorbed. But then you have to wait po doon sa natural tissue build-up. So some of my patients as early as 1 month, pwede kaming mag-add ng mga hyco threads. Because when we do the procedure, sometimes we start lang yung mga iba, 5 hyco threads lang, or we can do as much as 10 hyco threads, or we can maximize the number of PDO threads. So it's a case-to-case basis po. So for my patients before na nag-wonder, nung una, mataas, tapos parang after a month, medyo nag-subside, we can actually add some HycoPDO threads po para lalo lang mag-angat yung ating nose. So with Miss Mariah, we can see already the result.
Effect, yeah. This is the second time, so kaya mas maganda siya.
Yes.
Mas mataas siya.
Right. Kasi meron akong na-feel kanina when I was injecting, na-feel ko resistances. So meron pa rin dun sa loob na mga tissues from the previous procedure we have done. So less na yung space where I injected the filler and the threads. So it's quite different right now po compared sa before. Kahit si Mariah.
Para po ako nagpa-surgery.
Right. So I think you're not expecting this kind of result.
Yeah, I didn't expect this.
So yung tip projection and alor reduction, ito po yung naging effect ng ating PDO and dermal filler po. So this is an instant result. Okay? I could say it's natural looking, and I could still recognize Mariah.
Yes.
It is still Mariah.
No downtime.
And yon ang importante sa kanya. Kung meron man mga swelling, it's minimal, it's temporary.
Yeah.
I could say 1 day, 2 days, 3 days, okay na. She could,
And instant effect.
yes. She could again go back to her work.
Yeah.
So meron pa siyang wedding.
Second look na ako.
Yes. So this is much, I could say, a good procedure, a very effective procedure. It's very safe. Again, it's FDA approved. And only trust doctors who are trained with this kind of non-surgical nose lifting. So we go through a lot of trainings for this one. We go abroad also to learn all these techniques. Kaya yung ating mga televiewers, we only advise you to go to your certified aesthetic physicians. Ayan. So how happy is Mariah?
I'm so happy. It exceeded my expectation to my new nose. And most especially, it's so safe, painless, and no downtime.
Yes. O, ayan. So, mamaya, pwede nating ituloy yung Ulthera ni Mariah. Okay? So, we did the Botox for the masseter and our Asian non-surgical nose lifting, making use of our dermal fillers and our PDO threads. Thank you so much, Ma'am Mariah, for
Thank you so much, Doktora.
Yes, joining us and sharing with our televiewers.
I love it. I super love it.
Okay, ayan po. So, natunghayan na naman natin ang another non-surgical nose lifting. Kung meron pa po kayong katanungan, you may email me at csaskinclinic@yahoo.com. Our clinic is located here at the 2nd floor, Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0933-860-9193. I also have my FB page, CSA Derm Centre, FB Messenger, Contessa Salvador Alapag, Instagram, Doc_Contessa, our website, www.csadermcentre.com. O, ayan po. Maraming salamat sa inyong lahat. And kung na-miss nyo po ang iba naming mga videos, iba naming episodes, you can watch them at our YouTube channel. Only type Contessa Salvador. And please do not forget to click like and subscribe as well. So maraming salamat sa inyong lahat. Mariah,
thank you,
my
Doc.
staff, my assistants.
Thank you.
Of course, the providers of our Restylane, our PDO threads, to Science, thank you so much. And to our Lord, thank you so much. So, sa inyong lahat, God bless you po. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.